So, in honor of the upcoming Hygienist Appreciation Month, I'm going to start just a kind of a little series on podcasts, kind of specifically for the hygienists. And we're going to talk about things like perio charting and health history and hygiene goals and all of those really good things that the hygienists always want to talk about. And so I want to start off today talking about like your schedule, your practice, your production goal, and how you can be involved with that process. So we know that dental practices are working off of the smallest profit margins that they ever have, with the escalation of supply costs and the escalation of inflation all across the country in every genre of industry, especially dentistry. Our materials are costing more, our lab fees are costing more, our equipment is costing more. So our salaries have increased. Dental hygiene salaries have increased 8 to 16% across the country. And our reimbursement rates are flat. Reimbursement rates from dental insurance companies in some places, some states have actually gone down. I know in the state of Washington, Delta Dental has reduced fees again. I know in the state of Colorado, there has been a reduction in reimbursement rates. So our fees are not keeping up with the inflation that is going on all around us. So I think what we have to do is we have to be more cognizant about what we are producing in order to keep up with inflation. And the hygienist can take a very active role in not only comprehensive patient care, which is what you all went to school for. You all went to school for comprehensive patient care. You spent 2 years of your life in dental hygiene school learning how to treat patients effectively for periodontal disease. And if you're a seasoned hygienist, you've probably taken a lot of continuing education courses on new materials or new techniques, and you've learned over the years that patients benefit from maybe having fluoride treatment or periodontal therapy. What we do know in this country from studies from the ADA Health Policy Institute and other studies that have shown us that more than 50% of our Americans that live in this country have some version of periodontal disease. But so even though more than 50% of patients have periodontal disease, some form of periodontal disease, our percentage of periodontal treatment in our practices is still only at about anywhere between 5 and 20%. And so what I want to talk about first off is how the hygienist can actively take a role in comprehensive patient care, which will contribute to a higher production average. So what I'm looking for the hygienist is a production goal, either a per hour production goal or a per day production goal. They all kind of come out to the same thing. But I'm looking at, I usually will look at a daily production goal for the hygienist. And a hygienist should be producing about 3 times their total compensation. And so if you're a hygienist listening to this, and you know what your total compensation is, that includes your hourly wage, your benefits, any benefits that you might be receiving from your employer. It might be health benefits. It might be your doctor gives you a gym membership. Your doctor gives you scrubs, helps pay for your shoes, pay for your scrubs. Maybe your doctor gives you an allowance for eyewear or I'm not talking general eyewear. I'm talking like if they give you an allowance for specialized customized loupes or something, or you have benefits like or a some kind of an IRA account or something like that. So Total compensation is your hourly wage plus any benefits that you're receiving. So, for example, if you are a hygienist making $50 an hour and you have benefits like an K and healthcare benefits and things like that, you could potentially be making $60, $70, $80 an hour with total compensation. And then three times your total compensation would typically be what your hourly production goal would be. So, for example, if your total compensation is $80 an hour with all of your benefits, that would mean that you would need to produce about $210 an hour in order to achieve that production goal that we'd be wanting to look for in a hygiene column. So what does that mean for you as a hygienist? Well, what that means is then you are wanting to produce a mix of procedures in order to get to that production goal. So what does that mean? It means we can't do profis all day long. It also means that we can't do 1 hour profis all day long. If your profi fee is $100 and your goal is $210 an hour, then you are not contributing to the profitability of the practice, and also probably not giving the patient the comprehensive care that patient really needs and deserves. And so what we want to look at is the mix of services that we can offer patients in order to give them comprehensive care. So if it's a profi patient, we also want to see how often do we need to be updating their x-rays. X-rays should be taken based on clinical necessity, not on insurance company frequency. So if you have a patient that needs to have an FMX updated or a pano updated, how do we educate the patient on the benefits of having comprehensive imaging? We also can look at fluoride. Adult fluoride has been known to help in lots of different ways with tooth sensitivity, with recession, there's all kinds of health benefits for adult fluoride. There's also a lot of other different modalities that we can offer patients that would increase their overall health, oral health, and also increase the production for your mix of services. I would also encourage you to calculate what is your actual perio percentage in your practice. A lot of offices think that they're doing a lot of perio services, but when I actually calculate it, then it usually only comes out to anywhere between 5 and 20% of your overall hygiene practice is in perio services. So we want to think about, how are you diagnosing perio? Are you diagnosing perio? What other procedures will go along with perio services? There's a lot of different types of imaging or scans or perio modalities that can go into increasing the care of the patient and also increasing the production for the practice. And so we want to look at a mix of services throughout your hygiene day that will help you reach that production goal that has been calculated based on your practice overhead or your overall compensation for your hygienist. And so your mix of services throughout the day could be scaling and root planing, maybe at least one patient per day, scaling and root planing. That would significantly increase your comprehensive care for patients and also significantly increase your production for the day. When you do have just a profi patient that only needs a profi, think about, does that patient really need an hour? Okay. If I'm doing a healthy adult profi, does that patient really need an hour? If I don't need x-rays, if I don't need a doctor's exam, if I'm not doing any other services, does that patient really need an hour? And so we can also look at, if we're doing perio maintenance on a regular basis. Am I getting my patients in every 3 or 4 months? Are we keeping up with their imaging, their x-rays, comprehensive x-rays? Are we doing fluoride? Are there any other things that I could add into my day? Looking at patients that are coming in today. Are there any patients that have treatment on their treatment plan that I might be able to do as a dental hygienist? Does this patient have any sealants that need to be done, or a night guard impression? Or maybe they want to do some whitening, or maybe I could, increase my production by offering them some external services like Sonicare toothbrushes or a water pick or other kinds of things like that. That if I am doing a healthy adult prophy, does this patient maybe think about doing whitening, or do they have a night guard on their treatment plan? Can I talk to them about ortho? So there's other things that we can do proactively, like productively, if we're actually not at goal for that hour. Is there a way that we can talk to the patient about other treatment options to kind of make up for that loss in meeting the goal for that hour? I know that's a lot. I know hygienists, really a lot of you don't want to talk about production goals because you feel like I'm just pushing production and goals on you, and the only thing you want to do is treat patients. And I get that. I totally get that. And I don't want you to think that that's all I think about. I think about the whole entire practice as a whole. I think about the oral health and the systemic disease that is happening in our country. I think about how much the oral health of our patients affects the overall health of their body. And what a hygienist does is so important to the overall health of the patient. And also, in order for dentists to stay in business and to stay profitable, in order to be able to offer you raises, other benefits, be able to offer you better health insurance, be able to offer you a gym membership or healthcare benefits, or okay, is the practice has to be profitable. It's just a fact. The practice has to be profitable. Unless you are working in a Medicaid office, a community health center, your practice has to be profitable. And the hygienist plays a huge role in the profitability of the practice. And so I'm not pushing goals on you, but what I am saying is that you play a huge role in the profitability of the practice. And you also play an enormous role in the health of your patients. And so what I want you to do when you're done listening to this podcast is go through your day, like go through the next 3 or 4 weeks and see what kind of a mix of services do you have in your schedule. Are you doing a lot of hour prophies? And is there a way that you can offer other services to these patients that are coming in for an hour? Fluoride, look at their treatment plan, all those kinds of things that you can offer to the patient in order to give them the comprehensive care that they need and also help the profitability of the practice. Now, there's a couple other things that you can do in your practice to help your hygienists, to help you kind of review your goals, understand what your goals are. You can add those goals into Dentrix. You can preview the goals on your computer so you can see, okay, what is my goal for today and what do I have scheduled? And that can be really helpful to visualize and see it visually. And then I would calculate what your perio percentage is. And probably the easiest way to do that is my good friend, Rachel Wall. She is a hygienist. She is an incredible human being. She runs Inspired Hygiene, and she has a perio calculator worksheet. And I will have a link to that perio calculator worksheet that Rachel Wall put together in the show notes so that you have access to that. So that will help you to determine what the percentage of perio is in your practice. And that will also help you to determine, are we really diagnosing enough perio? Are patients accepting treatment recommendations? So I hope this has been helpful. It's kind of just my first podcast that I'll be doing for all of you, the Hygienist. And so I look forward to watching your journey of becoming a high performing dental team.